What's your name, your occupation, and where do you work?
My name is Jasmine Moore. I'm an injury prevention coordinator and I work at Grady Memorial Hospital in the trauma program.
How would you describe your occupation to someone who's not familiar with injury prevention or public health?
The short version of that is that I facilitate efforts to reduce and prevent injury and violence through research, project management, program development, and community outreach.
What are your day-to-day tasks or goals?
So my day-to-day task could consist of anything from running quality and research reports related to trauma injuries in the registry. I also participate in numerous meetings where I collaborate with partners such as IPRCE, the West Side Health Collaborative, the Centers for Disease Control and Prevention, Georgia Department of Public Health, and other partners across the state. Additionally, I go out into the community and I share information around injury prevention. I provide training. I assist in installation of car seats. And I also teach yoga for wellness and stress management and injury prevention.
Very cool. All right.
Hey, so Jasmine, if I could just jump in for 1 second. That's really cool. I've never heard of the yoga for wellness and injury prevention. I think students would be interested to hear a little bit more about that.
Sure. Yeah, so actually, I had a personal interest in learning to teach yoga. I had a personal practice, and so I completed teacher training on my own. And then in thinking about additional ways that we could engage the community, ways that we can engage the staff for wellness, employee wellness is definitely something that's up and coming in larger organizations now. I wanted to share that and expose more people to it. So since I had the skill and the certification, we opted to leverage it as something, as a component of our strategic plan in reducing workplace violence and promoting stress management.
Wow, that's cool.
Yeah, that's really cool. All right. What excites you most about your occupation?
There's so many opportunities to innovate and to creatively apply public health practice to injury and violence prevention. Injury and violence are not new as public health issues, but I do think that they're under-supported, they're underfunded, and there are a lot of people doing important work. And because we have to be creative in how we're continuing this work, I get the opportunity to collaborate across so many different sectors and work with people outside of the public health field in law enforcement, informatics, engineering, and healthcare especially. So I think there's a lot of opportunities to address the public health issue in unprecedented ways.
What would you say to a student who's considering applying to the Injury and Violence Prevention Certificate program?
I would definitely say go for it. There's a place for every public health professional and every public health skill set in addressing injury and violence prevention, anywhere from surveillance to policy to public health education. There's a role for everyone. And focused training in injury and violence prevention is rare. It's not a standard component of traditional public health training. And so to have an opportunity to grow those skills and have focused training in it, I definitely think is a great opportunity and something that everyone should explore.
Awesome.
Jasmine, I think that, you're so, your position is kind of so uniquely placed. It's in the community, it's also in a hospital setting. Can you tell us a little bit more about, how you manage two different settings and how they work together and how they're also very different, Just talk to us a little bit about that.
Absolutely. So this definitely may not be the case for all health systems or hospitals, but I've noticed that having an MPH and working in a healthcare setting is kind of a rare thing. But because of that, public health professionals can come with a very unique perspective as they are learning to access healthcare data. They're learning about organizational culture in the context of healthcare. But they also can learn, as I have, about how healthcare is positioned very centrally in some communities, especially at a level 1 trauma center or any other public safety net hospital, which makes it an optimum place to be doing public health work. And because of that, you may get opportunities to collaborate with partners that are doing similar work but have can leverage different resources, have different expertise, access to different funding, and are coming at it with a mission or a vision that is aligned with wherever you may be working or what your personal mission and vision are for addressing injury and violence prevention, but may be different in such a way that you can collaborate and do some really creative work. And so in a lot of ways, I'm positioned specifically at the hospital, but because of that positioning, I'm also positioned right in the community as well. And so they seem different, they're really not. It also helps that we partner closely with universities, that we're an academic institution, and we get to partner with Emory, we get to partner with Morehouse, and lots of other people coming through with training and different backgrounds.
That's awesome. I think it's so incredible that you're in that position, because a lot of times I think we learn things in class and through textbooks, and we don't always get to apply it in kind of those real world situations. And I think it's really awesome that you are in a position where you can really apply the things we learn in books and the things we learn in lectures to your everyday work.
Yeah, absolutely. And if I could share, I was finishing up my graduate degree when I started my position at Grady. It was a 20-hour-a-week grant-funded position, and it was very interesting to see that the work that I was doing did not necessarily align with what I was learning in my coursework. There were some things that, you know, definitely were fundamental and core, but translating that into the context of injury and violence prevention in the real world and actual practice was definitely difficult and not as natural as I thought. So it was a great opportunity for me to be doing that work as I was learning, which I think is another benefit to pursuing the certificate, because we have so many people and professionals doing the work right now who are guiding and supporting that certificate. It gives like amazing exposure to actual public health practice in a meaningful context.
If you're interested in applying to the IVP certificate, then email Dr. Dorian Lamis. You can also learn more about the certificate by visiting us on our website or social media.